Starting out on your back, place your hands right on the belly below the rib cage. Begin to notice your breath. And then focus on sending your breath into the belly. Inhaling and feeling the belly rise. And exhale as you feel the belly fall. Inhale, 2, 3, 4, 5, 6. Exhale, 2, 3, 4, 5, 6. Inhale, 2, 3, 4, 5, 6. Exhale, 2, 3, 4, 5, 6. Practice abdominal diaphragmatic breath every day. And the reason why it's so beneficial for you is because it stimulates the vagus nerve. This helps to stimulate the parasympathetic nervous system, allowing your body to rest, relax, and digest. Abdominal diaphragmatic breath will give you a deep inner sense of peace, allowing your stress to melt away. The benefits of belly breath are incredible. And it requires a practice because we don't automatically belly breathe. Many of us are superficial breathers. One way that I can tell if someone is not breathing efficiently, the chest rises and the belly sucks in like this. And then as they exhale, the chest falls and the belly pops out. That kind of breath is not encouraged. Immediately it starts to tense up the muscles of the neck and of the face and the jaw. You want to do the reversal. Feel the chest be still as you monitor the belly, feeling it rise with each inhalation and fall with each exhalation. Let's transition now. Float your right knee up above your hip. Place your hands on top of the knee or under the knee. Whatever feels more comfortable for you. Begin to create gentle circles, clockwise and counterclockwise. This is called hip telescoping to allow you to be aware of how the joint feels with this movement. If it is uncomfortable, you can rest your foot onto the bolster and just gently rock your knee side to side. Avoid any pinching sensations. Try now to place your hands underneath of the knee and allow your leg to extend up and down. Feeling length in the back of the hamstring and the calf. Relax the jaw, relax the face muscles. And then switch sides. Floating the left knee up above the hip, hands on top of or under the knee. Just begin to move it up and down. Circle it around. Once again, noticing how the hip feels with this movement. If you have a pinching sensation, modify or change. Maybe your leg needs to be down away And then you can just actively move it side to side. Add in a little bit of knee extension and flexion, placing the hands under the thigh, and then begin to straighten the leg up and down. Feeling length in the back of the hamstring and the gluteals, as well as the calf. And then rest. Let's begin pelvic tilt. Tuck the tailbone under, pressing your lower back down into the floor or the blanket. This is called posterior pelvic tilt, where your belly is hollowed. Then reverse, arching your lower back to create space under the lower spine. This is called anterior pelvic tilt, also spinal extension. Couple your movements with your breath. Exhale as you tuck the tailbone under, pressing lower back down. Inhale, arch your lower back to create space. Exhale and tuck. Inhale and arch. Exhale, curl the tailbone under, pressing the lower back down into the earth. Inhale and arch. Now we're going to find neutral spine. Tuck the tailbone under, pressing your lower back down into the surface. Your fingers can be on the pelvic bones, the thumbs on the rib cage. Now release that position slightly so that your pelvis and spine are in a parallel or a straight plane. You can also place your hands on the belly and the pubic bone. As you tuck the tailbone under, the fingertips will rise up. As you arch the lower back, your fingertips will drop down. When you find neutral, your pelvis is lying in a parallel plane with the floor. In neutral spine, slide your fingertips out to the lower abdominals. Clear the throat. Cough lightly. Huff. When you do those things, that increases intra-abdominal pressure in the lower belly. Now, try to increase that pressure without making noise by doing what's called an isometric contraction in the transverse abdominis. I also cue bracing the core, power breath, TATD breath, transversus abdominis, thoraco-assisted diaphragmatic breath. So you're tightening up your belly, draw the muscles of the pelvic floor up. Continue breathing through the nose so that the rib cage now begins to flare out laterally, a little bit outward and a little bit inward, instead of the belly rising up and down like it was with abdominodiaphragmatic breathing. TATD breath creates more of this lateral rib cage movement. Maintain power breath as you now float the right knee up above your hip. Lower the foot down and switch. Left knee floats up above the hip. Lower and switch. Alternate this marching pattern without allowing any movement in the pelvic bones or the spine. You're keeping the core transversus abdominis, the pelvic floor and the respiratory diaphragm, and the lower back multifidi muscles on the entire time. Transition now to hip release. Open the right knee out to the side just a few inches, making sure that the left pelvic bone doesn't move. Exhale to bring the knee back to the midline and switch. Left knee opens out a few inches without letting the right pelvic bone rock up. Exhale, bring it back into the midline. Inhale, open. Exhale, close. Inhale, open. Exhale, close. Maintaining this belly, pelvic floor, respiratory diaphragm, and lumbar multifidi. Core engagement the entire time that you're moving the hips. This is called disassociation. My hips are moving, but my pelvis is not. This is how we create stability in the spine and mobility in the extremities. And rest. Relax. Take a deep breath in and exhale. And again, inhale and exhale. Moving on to windshield wipers. Heel toe your feet out about mat width. Hands can stay on the belly or you can reach them out into a T. Begin to roll the hips, knees over to the right. And if you feel a little vulnerable in the spine, engage your core abdominal muscles right now. Begin now to imprint the upper thoracic spine, followed by the lower lumbar spine, and the sacrum. This will automatically bring your knees back to the middle. As then you roll your knees over to the left, you're going to feel an expansion into the right rib cage. As you then begin to imprint thoracic, lumbar, and sacral spine, continue rocking your knees right, center, and left, allowing this gentle rotation supported by the earth to increase blood flow into the spinal column, allowing you also to assess the integrity of your hip joints. Are you feeling a pinching sensation? Congestion? Do you feel discomfort in your sacroiliac joint? Is there irritation right back here in the SI joint? If there is, know that you can move smaller. You don't have to go to end range. And then bring everything back to the midline. And then now we will begin straight leg raises. Extend the right leg long on the mat. Pull your toes up towards the shin and recalibrate neutral spine by tucking the tailbone under, bracing the core transversus abdominis, and keep the rib cage pressing down into the earth. Lift the right leg up through molasses to the height of your opposite knee. Lower your leg back down through molasses. You want to create synergy, a synergistic co-contraction in the quadricep and the hamstring, the front of the shin and the back calf. Rest and switch. Left leg is long on the mat, toes lifted up towards the shin. Recalibrate neutral spine, engaging power breath. Begin lifting your left leg up and down through resistance to the height of your opposite knee. And then rest. Transition by rolling over onto your side. First, scoot left. Second, roll over onto the right. Third, use your hand and your elbow. Allow your head to look down at the floor as you press your body up gently and gradually. Moving into a seated position so that we can now transition to the next series. I hope that my exercise videos will help you to increase your strength and stability, improve your confidence so that you can do your daily activities pain-free. Thanks so much for watching, and I hope to connect with you soon. Namaste.